Hi, I'm Daniel Zengel with Regenotech here with Dawn Lipscomb, and we are doing a video series this week on the growth factors found in platelet-rich plasma. This video is all about vascular endothelial growth factor. It's quite a mouthful. Dawn, can you tell us a bit about that?
Absolutely. So this is another one of the growth factors found in the alpha granules of platelets. And also, interestingly, this growth factor is also secreted by macrophages.
Okay.
Which macrophages are a type of leukocyte, basically. And these are involved in coming in and cleaning up cellular debris.
Right.
And certain types, there are different types of macrophages, but there are some involved in clearing debris, and there are also some that are involved basically in helping to promote new tissue growth.
Right. That's M1 versus M2. Okay.
Yeah.
Got it.
Vascular endothelial growth factor on its own actually promotes migration and proliferation of endothelial cells. Now, these are the cells that actually make up the lining of blood vessels.
Right.
New blood vessel formation or angiogenesis is really critical for getting oxygen and nutrients to tissue, and particularly in situations like hypoxic tissue, which is just oxygen starved. It's thought that maybe things like tendinopathy is caused by tissue, not only just micro tears, but tissue damage caused by poor blood flow.
Right.
Because there's not a lot of blood flow initially leading to the tendon.
Yeah. And we'll see that with like diabetic neuropathy patients, for example. That just a lack of blood flow causes tons of issues.
Exactly.
So you're saying that the vascular endothelial growth factor can promote the formation of new blood vessels?
Yeah. So it stimulates migration and proliferation of endothelial cells, and endothelial cells are cells that make up blood vessels.
Got it.
So there are it has to work in conjunction with other growth factors.
Right.
So this is just part of a whole symphony once again.
Got it. So this is getting the raw materials in the area.
Exactly.
And then is there another growth factor that's responsible for building the blood vessels?
There's also basic fibroblast growth factor too.
Okay.
So we'll talk about that in
That'll be the
another video.
Next video we'll cover the fibroblast growth factor.
Yeah, but this growth factor would be really great if you just want to isolate them by growth factor and what they might be useful for.
Sure.
Like fat graft, you're putting in new tissue.
Right.
It doesn't have its own blood supply.
Right.
It's requiring, it's basically living off fluid diffusion.
Absolutely, yeah.
So the quicker you can get new blood vessels to go to it, the better.
Right, and I'm sure same with like a skin graft or
anything like that. But additionally, too much blood vessel formation might not be a good thing.
Right.
So in the case of some tendinopathies, what researchers have hypothesized is that tendons are tissue that don't really have much of a blood supply.
Right.
So this tissue, after it's damaged and perhaps it loses a portion of its blood supply, basically the body is overcompensating and it starts trying to regrow the blood supply.
Sure.
However, you end up with a lot of little capillaries that are going to the tissue.
Yeah.
And in I think it's in ultrasound, they'll see a lot of this like microvasculation form, and this is thought to maybe cause chronic pain. Like, for instance, if you have an ingrown toenail.
Yeah.
Your body's trying to, grow the toenail that was supposed to be there, but it just overcompensates.
Got it. So basically these vascular systems could be interacting with the tendon in a way that's...
Or with the nerves.
Oh, with the nerves.
Yeah,
okay.
So it's like growing into the surrounding tissue rather than like getting into that area that it needs to be in.
Right.
And so one of the ideas is that maybe PRP, because it causes sort of like this high concentration release of growth factors, much more than what would normally be present.
Sure.
So initially it causes this acute inflammation, but that inflammation kind of resets the clock.
Right.
And so then you begin this slow, gradual rebuild of the tissue and the structure that should be there.
Right, yeah. And we'll see that a lot of times, if someone has a chronic injury, that hasn't been healing, like arthritis or whatever it may be, that's taken place over a long period of time, and all of a sudden there starts to be this healing effect, there's going to be some acute inflammation a lot of times.
Yeah, exactly. So.
Great. Okay. So we're done talking about the vascular endothelial growth factor, but then we're going to be talking about the fibroblast growth factor next. So stick around.